Good morning, everybody, and welcome to our popular webcast, It's All in Your Head. My name is Rita. I'm the moderator, and today we have a topic that I know many of us want to know all about. Can neurotherapy help us to reach our fullest potential? Dr. Swingle, who is here with me today, will be talking about optimal performance training. Before we get started, let me introduce Dr. Swingle to those of you who are with us for the very first time. Dr. Swingle was titular full professor of psychology at the University of Ottawa prior to moving to Vancouver. Fellow of the Canadian Psychological Association, Dr. Swingle was lecturer in psychiatry at Harvard Medical School, attending psychologist at McLean's Hospital in Boston, where he also was coordinator of the Clinical Psychophysiology Service. Dr. Swingle is registered psychologist in British Columbia, certified in biofeedback and neurotherapy. His newest book, Biofeedback for the Brain, was published by Rutgers University Press. The book is available at www.soundhealthproducts.com. Again, that is soundhealthproducts.com. We always encourage all of our participants to submit questions. To do so, you can just use the chat feature on the control panel at any time during this webcast. We will have 2 breaks and we will be answering your questions during that time. Okay, we are ready to get started, so fasten your seatbelts and let me welcome Dr. Paul Swingle. Good morning, Dr. Swingle.
Good morning, and welcome everybody. Today's topic is optimal performance training, and we're going to be talking about the optimal performance training for athletes and for executives. But I'd like to start with going over some of the basics here so we all know what it is that we're dealing with. This is an electroencephalograph. So what we're doing here is measuring the brain activity at a specific site. The top line here is the raw brainwave signal coming out, and that raw signal is broken down into various waveforms, each 1 cycle a second in length. So we have going from 0.5 cycles a second all the way up to 40 cycles a second. So this is the amount of strength, energy, amplitude, electrical activity of the brainwave that's sitting at 40 cycles a second. Now, the other thing I'd like to point out is that this is a nice, healthy brain spectrum. What you should see is that the strongest waveforms, that is the waveforms that have the highest amplitude, are low in frequency. And as we say, the frequency should be inversely related to amplitude. That is, the faster the brainwave, the lower the electrical energy. So this is a nice, healthy-looking brainwave. Now, there are a lot of ways to optimize your performance. Get a good night's sleep, stop drinking alcohol, eat properly, and so forth. We're going to be focusing primarily on the neurological contributions we can make to optimizing performance. And we're going to be talking about very specific areas in the brain. And we're going to be using this rotating head here to kind of talk about the different areas of the brain. Now, the back of the brain is the area that's responsible for good quality sleep and good stress tolerance. The front part of the brain, areas in terms of rational thought and emotional content. And then we have areas of the brain associated with perseveration, thought processes, and so forth. So we'll be referring to this rotating head from time to time when we're interested in very specific areas of the brain. Now, whenever you're measuring electroencephalographic activity in the brain waves, you want to know where you are. So there's an international 1020 system to tell us where it is that we are. So if we're at CZ, we're sitting right on top of the head, and it's an area right over the sensory motor cortex. And I'll be referring to the various positions from time to time during my talk. The way that we treat, and many of you know this, of course, is there are several methods of treatment. The common one is neurofeedback, that is brainwave biofeedback. So what we do is we put the electrodes on the ear as reference and ground, and then there's an electrode on top of the head to measure the brain wave activity at a specific point. And when we're working with kids, we set it up so that when the brain's doing what we want it to do, the icon moves. When the brain's not doing what we want it to do, the icon stops. We have all kinds of games that kids play and so forth. And for adults, we can give them the actual feedback, and this is the screen I just showed you, of course. There's the raw signal, there's theta activity, alpha activity, beta activity, and the raw spectral analysis. Now, what my clinic is known for is what's referred to as brain driving. Now, brain driving is a very different protocol from brainwave biofeedback. And brain driving, we're actually using various forms of stimulation, light, sound, microamperage stimulation, EMF fields, and so forth, to nudge the brain into more normal, optimal functional ranges. And then we can stabilize it with neurofeedback. Now, in this particular case, and the individual has a set of goggles on here, and the goggles have LEDs, light-emitting diodes, on each side so that we can flash lights anytime we want, and we can control the frequency of that light. So if we're interested in increasing alpha activity, for example, those lights would probably be flashing at, say, 11 cycles a second. We have headsets on this individual so that when we want to present a sound to affect the brain activity, we can present the sound via those headsets. And often we are doing electrical stimulation of acupuncture points, and here we have electrodes on what's called pericardium 6. This is an area in the acupuncture nomenclature that's associated with quieting, and we find that it actually increases the strength of slow frequency in an area of the brain that gives rise to quieting. So we have the electrical stimulator. We have, these are called brain drivers, the brain driver cascades, and these are the mechanisms that we use for delivering the visual current, the visual stimulation, or the electrical stimulation, or the sound stimulation, and so forth. And it's all based on what the brain's doing, so it's real-time live. The advantage of brain driving, of course, is we can, in addition to optimal performance, because it's a very aggressive, very efficient method for helping the brain to first get normalized and then optimized. But the other advantage of brain driving is we can use it for clients who can't volitionally participate in neurofeedback. So we treat infants of 3, 4, 5 months of age, and we treat folks with Alzheimer's who really can't pay attention to what it is that we're doing, or folks in coma, for example. Now, very often we will give the individual a control. So this controls the intensity of the lights. This controls the intensity of the sound. Now, the reason we do this is if we're dealing with somebody who has, for example, a panic problem, if you suddenly turn on bright lights, you're very likely to precipitate a panic. So what we do is we give them the controls, and they can control the intensity of these things so that they feel very comfortable. So I'm going to start off with age-related declines. Optimal performance doesn't only mean athletes and CEOs of Shell Oil Company. It also refers to folks like me who are getting long in the tooth, and we want to optimize brain efficiency. So let's start with age-related decline, brain brightening, and dealing with cognitive inefficiencies. The primary factors associated in age-related decline: genetics, and how was your father doing when he was 90? Trauma, what have you been through in your life? Have you been through things that really affect your brain functioning? Disease, of course, and activity. The number one problem we have, particularly with males, is they retire into an easy chair, a bottle of whiskey, and looking at the golf course. Bad news. They're dead in 18 months, either figuratively or literally. So this is the recipe for cognitive decline. So if you want to really be very efficient in de-optimizing your brain, you have a lot of salt and a lot of inactivity. And you see, I tend to emphasize activity just so that you have an idea of what that means. It's action, movement, emotion, bustle, hullabaloo, and so forth. Okay, I think you get the idea. It's not only sitting in my chair with electrodes on, dealing with your brain activity. It also has to do with what you're doing, activity. Here's an elderly man, excuse me, and the problem here is there are two problems. One is he's depressed, and I'll show you what that means. And the other, and this is the biggie down here, which is brain efficiency, IQ, and so forth. And this is the ratio of slow to fast alpha. Alpha are brain waves from 8 to 12 cycles a second. And you want a lot of fast alpha and much less slow alpha. You can also measure this in terms of what's called peak frequency of alpha. If you look at the dimension of alpha from 8 to 12, you want to see where the peak of that is, and you want the peak fast, 10 or higher. So in terms of this ratio, in terms of my clinical database, the break point is about 1.5. Anything above that, people complain about poor brain efficiency. And as you notice, let me just go back here. This is 2.88. That's way up there. Okay, so typically measure the alpha frequency up over the frontal cortex, the executive portion in the brain, but you can measure it anywhere. We tend to measure it at location FZ, and if you remember, that's sitting right about there. And the lower the number, the better. So what do we do about it? Here's brain driving, what I just showed you. And what we're doing is we are presenting lights at 11 cycles a second, and my harmonic, referred to as omni. Omni is a sound that sounds like, but embedded in that sound are harmonics that have that we know suppresses slow alpha. We have a ton of research on that. And this is a brief session with this individual. They started, their slow fast alpha was 2.83, much too high. After a 12-minute session, they're sitting at 1.78. So you can see brain driving is a very aggressive treatment. It really gets the job done for us. Now, there's another thing associated with alpha, and that is how rapid you get responses in the alpha brainwave dimension. When you close your eyes, there should be a big jump in alpha when measured in the back of the brain. When you open your eyes, it should drop like a stone. That's referred to as the alpha blunting response. Now, in our initial assessment, this is the clinical cue, the clinical intake assessment. The difference between when this person's eyes were open and then following an eyes closed, how fast did it get back to its level after their eyes were opened again? And we want this below 25% or so, and it's taking a long time for this person to recover in terms of the alpha response at position CZ. It's even worse at the back of the brain, okay? So, and this is the alpha response. Let's just assume this is the alpha. And I ask you to close your eyes. It should be a big jump in the strength of that. And then when your eyes are open, it should drop like a stone. This is what it should look like. Now, there's your dimension again. Low frequency up to high frequency. This person's eyes are open now. And when the eyes closed, you're going to see the activity increase in strength right around here. It'll come up into this region here. Let's see, getting close to, there we go. There's your eyes closed. And you see nice, strong alpha responses. Okay, that's what it should look like, eyes closed. Now, her eyes are going to open right around here, and it should drop like a stone. And here it comes now. There it goes. Okay, that's what it should look like. You close your eyes, it should come up very sharply. You open your eyes, it should drop instantly. Now, there are, in this individual who had that very foggy thinking, there are also other problems. Here we've got a marker for depression. And we've got a marker for some poor stress tolerance. However, the point that I'm making is that when you're doing optimal performance, you have to take care of not only brain efficiency, how fast you process information, but you have to take care of anomalies that you find are associated with anxiety or depression or mood volatility and so forth. So, age-related enhancements. What's the benefit of just hanging around for a long time on the earth? Well, the first thing is you get wise. And that's basically pattern recognition. You've seen it before, and you know what works and what doesn't work. So, one of the things that a researcher at New York University has looked at is the paradox. You know, the brain seems to be getting a bit slower, but much wiser. Quiescence, you've seen it before. You know what the outcomes are likely to be. You know that people are not going to remember things anyway, so the heck with it. The Einstein phenomenon. If Albert Einstein were sitting in my office and complaining about poor memory, everybody around him would probably not notice it because of the very high IQ. His IQ was estimated at 160, I believe. And if he came down a few notches, nobody's going to notice it, but he will. And the question, of course, is a person functioning adequately in the general environment? That's one issue. The other issue is, how does the person feel? Do they feel they're losing it? And that's an important factor.
Thank you, Dr. Single. Very interesting. Here is our first break. I'd like to let those of you who are here for the first time know that if you would like to get our future announcements, make sure you are on our mailing list. To get on our mailing list, you can either email me. My email address is on your screen right now, rita@swingleandassociates.com, or you can go to our website, www.swingleclinic.com, and you can sign up for our newsletter and to put to be put on our mailing list right on the homepage. Some of you also might know that we did major renovations at the end of the last year, and our work has doubled in size. More space allowed us to hire new staff and expand our services. I'll be sending an announcement with more details about these services like neurophysiotherapy, sleep, EEG assessment, remote training, etc. So again, make sure you are on our mailing list. Okay, let's start with our first question. Dr. Swingle, how can mindfulness qualities like non-judgmental present movement awareness be trained with neurotherapy?
I'm sorry, non-judgmental focus, did you say?
Non-judgmental present movement awareness.
Oh, okay. I'll be talking about that in the next segment. That kind of training is an adjunct to neurotherapy, and I'll get into that in just a few moments.
Okay. Another question. In addition to brain driving, what do you find in terms of giving feedback to individuals for optimal performance? What have you found is the most effective rate of earning a visual or auditory reward, such as 70 or 85% of time? And also, have you found the inhibited, say, theta, high, beta, or rewarded frequency band to be the most important?
No. The question is, what are the anomalies, not what is a canned program. And the difference between optimal performance programs, which are set procedures, and optimal performance training is absolutely huge. Now, in terms of the feedback frequency or the feedback percentage for optimal performance, the general rule of thumb, of course, is that you should be getting a reward about 70% of the time. That's a clinical judgment. If I have a child who's bouncing all over the place, I might put that up around 90%. And he gets really intrigued with the game, and then I start raising the ante. So I'll drop it down to 80% and then drop it down to 75%. But I let him know what I'm doing. And that is, the analogy is a high jumper jumping over a bar. You know, once you get good at 2 feet, I'm going to make it 2.5 feet, and so forth. And one of the things that I don't do a lot of is putting inhibits on training. Excuse me. What I do is I watch the raw spectral analysis, and if I see that what I'm doing is causing an increase in some particular waveform, then I will put an inhibit on. It's not one-size-fits-all canned programming.
Thank you. How about optimal performance for Alzheimer's? Can this condition be reversed or helped?
At the present time, if we catch Alzheimer's very early, we can delay it. And I think that's true of everybody who's working in this field. You see very, very serious Alzheimer's, very late-stage Alzheimer's, and the caregivers maintain that they see benefit in terms of what we're doing, in terms of social presence and so forth. And there is an element associated with that in terms of increasing the family's ability to interact with the individual with Alzheimer's. So there are benefits, but the notion of reversing it, no. We have not been successful with that, and I don't know anybody who has, but a lot of people, including ourselves, feel that we have a number of cases in which we're able to delay or slow down the process.
I have a similar question here in terms of dementia. How effective is brain driving with the elderly with dementia? And also, when is dementia too severe to treat? When is dementia too severe to treat?
Okay. Dementia is a different issue. Dementia typically you find the problem in the alpha densities and the alpha returns. So you can make a huge difference with regard to brain brightening in conditions of dementia. Also, you can make use of the Budzinski procedures, in which you can use audiovisual stimulation that the client uses at home. My Omni harmonic and sweep harmonics are very effective for making the alpha parameters much more efficient. Like anything else, the further down the road you are, the more difficult it is to get some improvement, and the lower will be your threshold of improvement. You're going to reach your brick wall, as we say, sooner, the more serious the dementia.
Are the improvements from optimal performance permanent?
The area associated with alpha is not permanent. Now, you can increase the stability of that by engaging the brain and making use of home treatment procedures like the use of Omni, for example, will sustain the gains that we make in treatment. But alpha is vulnerable to age-related declines. It's vulnerable to poor sleep, and so forth and so on. Now, the best metaphor I have for optimal performance is physical fitness. If you go to the gym and you get yourself in decent shape and you want to sustain that, going to the gym maybe twice a week and doing a full workout may be adequate. If you're an athlete in training, it's not going to work. You're going to have to be in the gym every day in order to sustain those gains. And I'm very clear about that with my optimal performance folks, that optimal performance means exactly that. We're not just making it better, we're making it optimal. And there's a lot of maintenance that goes into keeping yourself with that extra 2 or 3%.
Thank you, Dr. Swingle. We are going to move on. We'll answer some other questions during our second break.
Okay, optimal performance with athletes. Common problem. This is an athlete who, in this case, track and field, and she folds under pressure. And we have a look at this, and we can see what the problem is instantly. Up on CZ, we don't have any problems at all. Back of the brain, we have pretty substantial deficiencies in the back of the brain in terms of what I call the quieting ratio. And that is the ratio of slow to fast activity. You want this ratio sitting up roughly 1.8 or so. And you can see it's way under that, both eyes open and eyes closed conditions. That's associated with poor stress tolerance. The individual gets out on the course, starts fretting and worrying about it. All of the parameters associated with stress kick in, and she starts to feel all of the severe physiological responses associated with stress. And she's got a contributing factor here. And that is, there's hyperactivity of a region of the brain under the front midline referred to as the anterior cingulate gyrus. And this is the ratio associated with how hot that is or how active it is. And we want that sitting roughly 0.4 to 0.6 kind of range. She's up in the range of what we refer to as perseverative behavior. That is, she gets something on her mind, can't get it out. Now, she gets on the track, she gets stressed, all of the stuff, I'm going to fold, I can't do it, and she can't let go of it. So there you go. Perfect storm. So part of what the optimal performance for this person would be is take care of the neurology of it, and we have to also take care of the imagery. What is she thinking about when she gets out on the track? Now, the focus that I'm doing today is the focus is on neurology, but that's not the whole story, as any coach will tell you. Optimal performance refers to guided visualization, to learning how to really rapidly quiet yourself, and the kind of focus you have, internal versus external focus. So in her case, these are the two areas of the brain that were responsible neurologically for her problem. Anterior cingulate gyrus, sitting right under there, was hyperactive. It's the same dimension associated with obsessive compulsive disorder, and the back of the brain. So she can't quiet herself. All of the stress factors kick in, and she becomes very mindful of them, and she perseverates on them, and she folds. A miracle waiting to happen. This is easy to deal with. Now, this is the Wall Street Journal in July 2006. I'm talking about the use of neurotherapy in sports. And it's, golfers, and there are guys in my field who specialize in masters level golfers, the football folks, and Italy's World Cup winning soccer team during that year. Now, I have a secret, so everybody has to keep this secret, okay? The fella who did that, his name is Bruno De Michelis. Now, I'm sitting in my office, and I can look into Bruno De Michelis's apartment, which is a block away. So Bruno is in Vancouver. Now, Bruno went from Milan, which is the team they're referring to here, to England, and guess who grabbed him? The Canucks. So next year, Bruno starts with the Canucks, doing all of this sort of stuff for the Canucks athletes. So the other teams might as well not get on the ice. It's a done deal, but keep it a secret, please. Okay, internal versus external focus. And there was a question that refers to the issue associated with focus. This is pretty straightforward research done by Wolf. He's done a lot of excellent stuff here. This is just a jump and reach task. How high can the person jump? And the external focus is to focus on the rungs of the measurement device. Okay, so that's where they're focusing. The other is internal focus on the fingers with which the rungs were to be touched. Okay, and they measured the muscle activity. And there's no difference in muscle onset times. The interesting thing is with external focus, there was generally lower EMG activity, that is lower energy in the muscles. The jump height was greater with external focus as opposed to internal focus. This is true in several other experiments. This is the slalom type movements on a simulator, in which the person was given an internal focus, their own feet, versus an external focus in the same general area, which were the wheels on the platform, which are located directly under the feet. And the external focus instructions enhanced learning. The internal focus instruction was no more effective than no instruction. And a similar kind of experiment on a stabilometer. External focus on the markers on the platform versus internal focus on the feet, and more effective with external focus. Now, this just gives you an idea of some things that are adjunctive to the neurofeedback and neurotherapy. You fix the brain, but there are lots of other things that you can do in terms of performance enhancement. So the sports folks know all about this external focus business and guided imagery and so forth and so on. What we're focusing on here very specifically is the neurology of it. Elite athletes, they tend to have higher amplitude, slow frequency in the front part of the brain, and translation, they don't overthink. A lot of this has become automatic. And the other thing is they have higher amplitude alpha in the back part of the brain. And that's associated with a couple of things. It's associated with visualization, good visualization, but it's also associated with quieting. Now, when we do brain driving, we can increase alpha amplitude in the back of the brain. O1 is right in the back of the brain. And here we're using a situation in which we're turning on 10 cyclosecond lights, and we're also using an acupuncture point, which is on the wrist, to push alpha and, as we call it, grab alpha. When alpha is doing what we want it to do, we turn on the lights to hold it there. And the increase in alpha during the brain driving was almost 150%. And then we look at how strong the alpha is, not when brain driving, but just a pre-post test. Here's eyes open, eyes closed, 10 seconds, eyes closed for 20 seconds, and you can see the percent increase in the alpha. Now remember that demonstration that I put on in terms of the alpha response. You close your eyes, alpha should come up very sharply. And here it's coming up rather slowly. In 10 seconds, we only got an 8% increase. In 20 seconds, we're at 40%. We want it above 50. After the training, we doubled the amount in 10 seconds, and we're in normal range after 20 seconds. So I would do another few sessions with this person to strengthen the alpha to get it up to where we want it to be. Optimal performance. It doesn't mean only athletes and the CEO of Shell Oil. It also refers to singers and dancers and all kinds of performers. There's a person who specializes in this. Her name is Ray Tattenbaum, and she's in a suburb of New York City. And she deals with Broadway performers and so forth. And if I've actually had a workshop with her, and the changes she gets in a single session are just remarkable. One of the things we always do with performers is make sure that the back of the brain is really healthy in terms of the ability of the brain to calm itself. Now, we keep coming back to this theme, and what we want is we want the ratio of slow to fast activity to be elevated in the back of the brain. We want it up 1.8 or so. Now, there are a number of studies showing this. These are musicians in the Royal College of Music, and they had a blind assessment of their musical performance before and after. Their performance and grade improved 2 grade points versus control with alpha theta training. Now, what that is increasing the amount of alpha and theta in the back of the brain. Interestingly, there was no pre-performance difference in state anxiety with these folks. Same is true with dance. And here's the alpha theta training, the percent improvement relative to control, and you can see very, very nice increase in the performance of these dancers as a function of increasing alpha and theta strength in the back of the brain.
Thank you, Dr. Swingle. We have lots of questions here, so let's get straight to the questions. I heard a sports psychologist talk about doing relaxation exercises for athletes. Wouldn't too much relaxation be a problem for an athlete?
Yes. There's an optimal level of all of these things. And the ability to know what relaxation feels like in the body and the ability to get there rapidly, that's what we mean by optimal performance.
What about medications? Would you recommend any for optimal performance?
0.
And what about brain injury with hockey players? Can this training help when they get concussions?
Yes. We have a lot of interesting data on that. Dr. Dr. Gluck in Florida has some interesting data on NFL players, those who have had neurotherapy and those that have not had treatment over a period of time, those who have had serious concussions. And what you get is a profound drop in the alpha peak frequency. That's what we were talking about before. That's also associated with age-related declines. Excuse me. Over a 2-year period, an untreated NFL player had a decrease of, if my memory serves me right, a decrease of about 30% in the alpha peak frequency, directly related to brain efficiency. And neurotherapy with these folks can make a huge difference. By the way, this is the kind of training that's used for combat veterans who are coming back with concussive injuries to prevent dementias and so forth. So it's an extremely effective treatment for that. Typically what we do, obviously, is a brain map after the players had a concussion, and just to see what it is we're dealing with, and then we do neurotherapy to help speed up recovery.
Thank you. Does Cipralex help to relax the brain? I'm an athlete and was prescribed this.
I wouldn't touch it. What you're dealing with is an antidepressant, and although it's a forgiving antidepressant, fix the neurology of it and be done with it. Any medication has a side effect. It wouldn't be effective if it didn't. And one of the side effects of antidepressants is it directly affects the speed of alpha. I mean, of course, that's why it works. And there's a lot of evidence for this. What you do when you're dealing with the benzodiazepines, or when you're dealing with the antidepressants, is you get decreases in the alpha peak frequency. There are a lot of other things that happen, and there's a very substantial literature on this. In any event, the bottom line is stop taking meds. That's not the way to deal with optimal performance.
If I don't have access to brain driving equipment, can I do traditional neurofeedback at FZ and reward higher alpha while playing Omni?
Oh, of course. Most people are doing this with neurofeedback, not with brain driving. Brain driving is just a more aggressive way of doing this, and it really markedly reduces the number of treatments that are required, and it also opens up a much broader range of clients that you can treat. But you can certainly get the job done with neurofeedback.
I'm recently trained Brainmaster 19 channel Discovery Z-Core trainee. Are there Z-Score protocols for performance enhancements?
I'm going to say no, and the reason for that is I am not a believer in protocols. What you want to do is find out what kind of anomalies you're dealing with first, and then you design your protocols around it. Now, Z training can be very effective, and basically what we use it for is to start the brain to becoming more responsive. So we typically use 4-position Z-score training occasionally, and then we switch over to brain driving.
And we have time for one more question. How many sessions do you work with optimal performance with executives and athletes?
Depends on what they come in with. If they come in with a lot of anomalies in brain activity, and I'll be going over a couple of cases with you. Once we get that sorted out, and then the question is how rapidly the brain responds, and we ask the individual to give us feedback in terms of where they want to set. So we can adjust a lot of these parameters so that where they feel comfortable in terms of the theta beta ratio in the back of the brain, how hot they want the anterior singular gyrus, and so forth. It's a very precise methodology, and that's what we mean by optimal. Optimal is the key organizing concept here. Optimal.
Thank you, Dr. Singer. We'll have to move ahead.
Optimizing the executive brain. Okay. Typically, whenever you talk about optimal performance training, people think of executives and athletes, and there's a ton of books out in which they have an athlete and an executive on the cover of the book. And presumption is both have to function under stress, make rapid decisions, etc., etc. Now, better or optimal, and if you are working with canned programs, you're going to make it better. I don't have any question about that. You relax somebody, they will perform better. Just exactly what we showed with the dancers and the musicians. Better is not optimal. And what we mean by optimal is that you get the brain functioning in a very efficient, optimally efficient fashion, and you're going to pick up the extra 2, 3, 4% that will make you the guy that walks out with the green jacket. Okay, the guys that are down on the golf course at Augusta are all great, and the guys that are optimizing are the guys that walk out with the green jackets, and that's what we're talking about. We're talking about optimal, not just better. There are tons of optimal performance or peak performance protocols, and a lot of individuals who decide that they're going to make money on this have put out devices or protocols or whatever that are one-size-fits-all canned programs to improve things, and they will do that, but that's not optimization. There are 3 stages to optimal performance training. The first is identify brain inefficiencies. What is the guy walking in with? Okay, we want to make sure that, to use the old metaphor, make sure that the foundation is good before you build the house. After you identify them, then you want to correct them. And then once you've corrected those anomalies, then you go to optimizing brain efficiency. Now, let's just follow a guy through this process. Stage 1. What are the problems here? Okay, so at CZ, we're not seeing anything. No problems. Here's his alpha response. We want it above 30%. Way above that. Back of the brain. Okay, we're picking up some stuff here. Here's the ratio of theta to beta, eyes open and eyes closed. We want this above, in an executive, above about 1.6. A lot of executives like to sit at 1.6, 1.65, as opposed to the normative range is 1.8 to 2.2. The guy's got a sleep problem, and that is where the eyes closed theta beta ratio is quite a bit below the eyes open. So I want to probe him about that. If you have bad sleep, we're going to do optimal performance training till the cows come home, and you're not going to get anywhere until we get the sleep better. Its alpha response is really good at the back of the brain. We want it above 50. He's 100. Front part of the brain, F4 is the right frontal cortex, F3 is the left. Bingo. Okay. This fella has depression, and he has emotional volatility, among other things. Now, his low-high alpha is pretty good. We want it below 1.5, so we're not dealing with a problem with smarts here. His anterior singular gyrus is hot, 0.77. Now, a lot of executives like to keep that on the high side as well because it's willfulness. One of my fellas who's in our optimal performance program said that somebody compared him with a pit bull. and that the only difference between a pit bull and this fellow was a pit bull will let go when he's, when he has your leg in his jaw. The pit bull will let go when he's hungry. Okay, this guy won't. Okay, so we know that we've got a problem here. We want to quiet that down a bit. We know that we've got some problems over at the right prefrontal orbital cortex that we want to get under control. That's the depression and mood volatility. And he's having problems with quieting and also with sleep. Okay, so we fix those up. You can see that the back of the brain, he's sitting up around 1.7. That's fine for an executive. Front part of the brain, everything here is under 15%. He's doing really good. The anterior cingulate gyrus is still a little hot. Okay. And so what we've done is we've equated the F3 and F4. We've taken care of reducing this a little bit, and we've gotten this up into acceptable range. Okay, so we've made the foundation okay. Now, stage 3, optimizing. Theta-beta ratio, he feels good around 1.6. And what that is the edge. And that is, you go to a movie, and when you're watching the film, you have a few balls in the air. That is, you're solving a few problems. In other words, there's always something going on. A lot of guys feel really comfortable there, keeping themselves at around 1.6, 1.65. Front part of the brain. Okay, what are we picking up here? Now, we've got everything nicely balanced. We have his low-high alpha in good shape. We brought the anterior cingulate gyrus down. 0.6 is good for an executive. It's willfulness, but it's not too hot. This is reactive depression. Okay, here we have a situation in which the left prefrontal orbital cortex has elevated alpha relative to the right. That's the Davidson model. For those of you who are neurotherapists or psychologists, know that Richie Davidson found that when alpha was higher in the left relative to the right, the individual admitted to depression or dysphoric mood states. And they've actually done some research on that. Rufus and Elsie Baer and some other folks have actually done experiments in which they make a person feel sad, and they find that you can elevate that slow frequency. That's why we're more inclined to think it's reactive as opposed to neurological. So what do? We do not fix reactive depression. The number one error that's made, in my judgment, with reactive depression is we try to treat it. We put a person on antidepressants. Huge mistake. Huge. Okay, so what I want to do is find out why this guy has this, and there was a reason, and it was a grievance issue, the loss of somebody, and you're supposed to feel sad under those conditions, and you're supposed to deal with it. And I had that chat with him, and he agreed. So this is the optimal performance model, and we followed a guy right through. First, we identify what the problems are, verify them, make sure that what we find in the brain map is exactly what he's experiencing. Then we correct them. Excuse me. Then we optimize the brain. Excuse me. So this fella comes in about once a month or so, just to make sure everything is optimal. Sleep. Now, I referred earlier to the fact that if you're not sleeping, you're not going to be optimal. And a lot of individuals have very poor quality sleep, even though they're clocking the hours. So we do sleep assessments here, and this will give you an idea of an individual who's got a problem. This is deep wave sleep, okay? And deep wave sleep, you want anywhere from 30 minutes to an hour of deep wave sleep. You're sitting at 57%. That's okay. I'm sorry, 57 minutes. That's okay. Now, what's the story here? REM. Now, if you look at the REM, there's only one trivial little REM cycle that's going on here. REM is hugely important. Deep wave helps you to integrate physiologically, helps the body recover. REM helps with integration of what you've learned during the day, dealing with all of your emotional stuff. This person is severely REM deficient. Okay, so in addition to the optimal performance of all the other stuff, we want to see what we can do about that. And there are a few ways of approaching that, but knowing what's going on is critical. Now, a few things about what optimal performance is not. If I'm at a raceway, I'm not going to hear this on the loudspeaker. The Volkswagen Beetle has just overtaken the Ferrari in the last straightaway. It's not going to happen. So if you come in here and you couldn't hold a tune in a basket and you want me to make you a concert pianist, I'm going to send you to somebody else. It's not going to happen. It's not brain replacement. It's increasing brain efficiency. It depends on what you bring to the table. Now, a quote I like that kind of captures this was T.S. Eliot when he was talking about the relationship between Charles Dickens and Wilkie Collins. And Wilkie Collins was a very good writer, but he was not a Charles Dickens. And what Eliot had pointed out is that Wilkins had learned as much as a man of talent can learn from a man of genius. Okay? We get increases in IQ. Now, I think the important thing to really keep in mind here is what you're doing is you're making the brain more efficient. The skills and so forth that you bring to the table are going to be maximized. Now, the interesting thing about neurotherapy, this is the work of Joel Lubar, by the way, is that you get increases in every one of the subsets of the IQ test. All of the verbals and all of the performance, every one of them goes up. So it's right across the board, and that's what we mean by efficiency, of course. Everything gets better. This is the work of Dr. Tanzi. The interesting thing is that the increase that you get is about the same no matter where you are. So people who walk in with superior intelligence are going to pick up a bit. And here you can see they're picking up, roughly 18 to 20 IQ points. Some people don't respond. And what you have to do is figure out why they're not responding. And these individuals are doing regular neurofeedback. And when they don't respond to neurofeedback, we get out the rubber hammers, as we say, and we do brain driving with them. Now, these are individuals who received high alpha training. And individuals who responded to the alpha training, that is, their alpha increased, their performance increased by about 20%. The individual who did not respond to the increased alpha didn't improve on the cube rotation. This is part of an IQ test, a German IQ test. Okay, normative versus elite. Here's a normal profile. This individual's anterior cingulate gyrus is on the high side of the normal range. And the low-high alpha is 145. It's in the normal range. So this person's going to be, happy as a clam. Everything's fine. That's not what we mean by elite. Elite, we would probably make this more active. That is, we would come outside the normal range, bring this up to 0.6, 0.65, and we would drive this way down. We would drive this down in the range of 1, 1.1, 1.2, that sort of thing. So markedly increase the IQ and brain efficiency and increase the willfulness and the determination. The omniharmonic, the one that we have that decreases slow frequency amplitude, also often increases exactly what we want, and this is fast alpha. This is the work of the late Dr. Budzinski, who actually did a brain map on my omniharmonic, and that's what this is, my omniharmonic. And this is beautiful. This is a suppression of low frequency and low frequency alpha, and the fast alpha gets a nice increase in amplitude. So this is increasing the guy's brain efficiency quite substantially. And this is just listening to that harmonic at home. And of course we can brain drive it. That's exactly what I showed you before. And this is a brain driving in which the lights come on at 11 cycles a second. The omniharmonic that I just showed you in the last slide comes on when there's too much slow alpha, that is when it's above threshold, and what we get is a very nice speeding up of alpha, increase in the density of high alpha relative to low. Okay, commercial time. This is my book, and a lot of the things that we've been talking about and some of the basics are included in this. And the clinician's guide for those clinicians that are in the audience that want to know about some of the basic parameters in terms of the clinical assessments.
And we also do lots of trainings for professionals. Dr. Swingle does online classes, online webinars. For more information, you can go to www.bfe.org. That is Biofeedback Foundation of Europe. You can actually get on the classes and webcast right there. All the information is there. And you can also email me if you have more questions at, again, rita@swingleandassociates.com. And we also do workshops for professionals here in town at our clinic. The next one coming up is in May 4th to 6th. We are going to follow that workshop with advanced workshop from October 26th to October 28th, 2012, also at our clinic. You can actually get information about both of these workshops on our website as well. On the homepage, we have announcements about these workshops. And for the general public, we are doing public lecture. It's going to be this coming Wednesday, April 25th at 6 o'clock in the evening. We are going to be at the Vancouver Central Library on Georgia Street in downtown. Admission is free. Anyone can attend. Seating is limited. We have 130 seats available, so I would advise you to come early to secure your seat. And that concludes our Optimal Performance webcast. We might see some of you on Wednesday, but we hope you enjoyed this webcast, and we will be back on May the 12th at the same time, 10 o'clock Pacific time, 10 o'clock in the morning, and we'll talk about attention deficit disorders in children and adults. Thank you very much for being with us today. Thank you, Dr. Swingle, and have a great weekend, everyone.